Okay, everybody, part 2 of dissociative identity disorder. So, while in the last video, I said for treatment there is no magic pill that's going to help with symptoms. However, there are medications that can help treat symptoms that may come up through therapy, through working through the abuse and the trauma. So we can utilize some antidepressants for sadness or anxiety, mood stabilizers for mood swings, and even antipsychotics for severe distress or hallucinations. And of course, the side effects with all those medications we've talked about numerous times, they all still apply. Drowsiness, weight gain, nausea, emotional disturbances. But what I really want to get into in talking about DID is not just how fascinating the brain is and how it can work to protect oneself, but I want to clarify and correct how media has portrayed and Hollywood has portrayed this disorder through the last few decades. Some of you maybe have seen the movie Sybil. That was where I was actually first introduced to this disorder. And it's probably the best portrayal, I would say. More recently, if you're a Marvel fan, Moon Knight, that character has dissociative identity disorder. And I love that show just for that simple reason. And I caught it right off the bat. And I don't know if it was intentional for them to create this persona with alters like they did, but kudos to them if it was intentional, because they did a really good job. But media portrays it as someone who, with this disorder, their alters are evil or violent. We've seen it, portrayed in some criminal dramas before, and it's just not the case. Their alters are protectors of that person, because they were developed, to help them survive childhood. They're not dangerous. Another myth is that they may be super dramatic or have magical capabilities of some sorts, but that is also not the case. They form to protect the person, like I said. These alters, they help the person manage anger, manage pain, and just with their daily tasks in life, because their severe trauma has not let them grow and learn, as most people do. So a lot of people assume that someone with DID, they're just pretending. But it's a real disorder, and it is recognized by the DSM-5, and it's backed by decades of research, albeit very difficult to diagnose, which is why some people think that they're just faking it. They're not just moody or attention-seeking. DID is about one's identity and memory, not just their mood, and it's often invisible to others, and it may go for long periods of time before it's diagnosed. Another myth is that they have dozens of personalities, when in reality it may just be 2 or 3. Others may have more, depends on the individual. It's different for every person, but the general rule is there's maybe no more than 2 or 3. And to be able to support them, you need to believe them. Validation is part of their healing. Yes, you do have this alter. Be patient with them, because progress, working through this type of childhood trauma in therapy, takes time. It is not going to be overnight. And avoid pressure for them to integrate or be normal, because that's not going to happen, at least not without years of therapy. Respect each of their identities as part of the whole person. Don't treat them any different just because it's their alter. It's still the same person. And encourage them to go to therapy, follow through, trauma-informed care, find those providers who specialize in that. And if you're helping them, don't forget to take care of yourself too, because this is going to be intense for them. And if you're their support person, it's going to be just as intense for you. So dissociative identity disorder, it's complex, and healing is a process, but it's possible. And so there is some hope. Supporting and understanding in therapy can make a huge difference. And as much as I love this disorder, it's quite rare. I've only ever seen it one time. And I'm not even sure it was 100% real. Like, it's so hard to decide. I had one patient who basically an alter came out in front of me because there was a situation she was not happy with and it made her angry, but she didn't deal with the anger. She was a very sweet lady. But her alter was not a nice person, responded to everything with anger and malice, and she was a little scary. And getting her back to herself took a lot of reassurance and supportive care. Like I said, her regular self was absolutely adorable, and she was very sweet. And she was older. She was, I think, in her 50s. And this was a fairly new diagnosis for her. So there was still a lot she was working through. But it was incredible to see. And like I said, it's one of my favorite disorders. And I hope you guys enjoy learning about it. Drop me any questions or any comments in the comment section, and like, share, and follow for more videos and more personality disorders. See you later.